Hello, I'm Sally Lindsay, a senior scientist at Holland Bloorview Kids Rehabilitation Hospital. And today I'll be speaking about ableism in the healthcare professions, a review of the experiences and impact of ableism among healthcare providers with disabilities. People with disabilities experience concerning rates of ableism and are significantly underrepresented within healthcare education and professions. Focusing on healthcare professions is important for enhancing the diversity and inclusion of equity-deserving groups within the workforce. Approximately 15 to 20% of people with disabilities represent the working age population. However, less than 5% of health practitioners report having a disability, making it one of the sectors with the lowest representation of workers with disabilities. Such trends are often a result of discriminatory attitudes and behaviors that can leave people with disabilities feeling marginalized. People with disabilities experience persistent disability-related discrimination, also referred to as ableism, which refers to unwanted, exploitive, or abusive conduct that violates their dignity and security or creates intimidating or offensive environments. People with disabilities are often reluctant to disclose their condition due to fear of stigma and discrimination, especially in healthcare, where others may perceive that they are unable to perform their jobs safely. Although many countries have legislation to support the rights of people with disability, ableism is persistent. Employees with disabilities are often fearful of disclosing their condition due to stigma and ableism from either coworkers, managers, and employers. Within healthcare, there might be a reluctance to disclose a condition due to fears of raising concerns about practicing safely. The underrepresentation of people with disabilities in healthcare professions is a social injustice leading to a lack of workforce diversity. Some of the challenges often experienced by people with disabilities pursuing healthcare professions include things like inaccessible university admission training and processes, unsupportive supervisors and professors, ableist technical standards, clinician and patient expectations, lack of accommodations, stereotypical views about the capabilities required to deliver safe care, and a fear of disclosing their health condition for fears of stigma and discrimination from their coworkers. So the objective of our study was to explore the experiences and impact of workplace discrimination and ableism among healthcare providers and trainees. So we used a systematic review methodology where we searched 7 databases and we had pairs of reviewers screening the articles and extracting the data. So some of the key terms that were involved in our search, terms related to discrimination and ableism, terms related to various types of healthcare professions and disabilities. So our inclusion criteria involved a sample of healthcare providers or trainees with a disability. It involved empirical studies that had at least one outcome focusing on ableism or discrimination, published in a peer-reviewed journal within the past 20 years without language restrictions. So looking at an overview of the participant characteristics of the studies that were included in the review, so our search involved 48 studies representing over 13,000 participants across 6 countries over a 21-year period. And these involved various types of disabilities. So looking at some of the key trends that came up across the articles, they were focusing on rates and types of ableism, and also impact of workplace ableism. So, for example, 7 studies reported on rates of workplace ableism within healthcare professions. Um, so, for example, medical students with disabilities experience significantly more stereotyping compared to medical students without a disability. 9 studies describe how institutional and organizational barriers influenced ableism within healthcare professions. Healthcare students described that there were often embedded assumptions that health professionals don't have disabilities. They also highlighted the difficult bureaucracy that was often involved with disclosing their condition and in asking for accommodations. For example, one study reported that 46% of registered nurses with a physical or sensory disability experienced organizational barriers where their employer often did not provide reasonable accommodations. Things such as automatic door openers, inaccessible meeting rooms, difficulty with steps and stairs. Some of the studies found that institutional ableism often either implicitly or explicitly framed wellness as a means to optimal work performance. Seven studies also reported on the lack of supports and unsupportive work environments. This involved things such as difficulties accessing disability services, difficulties receiving accommodations, unsupportive supervisors or managers, and the participants in the studies also often reported that sometimes they were treated as a client or a patient rather than a healthcare professional. The majority of the studies reported also on experiences of individual levels of ableism, which included things such as negative attitudes, stereotypes, stigma, bullying, harassment, and various other forms of both overt and indirect types of discrimination. So 31 studies described the impact of workplace ableism in the healthcare professions, including difficulty disclosing due to fear of stigma, the impact of health and wellness, and the impact on job and career. And factors affecting decisions to disclose included things such as sociodemographic characteristics like age or gender, workplace circumstances, nature of the health condition, and also the type of health profession. 8 studies reported on the impact of workplace ableism within healthcare professions and the impact on health and well-being. So, for example, a study of healthcare staff in the UK found that experiencing or witnessing bullying behavior was associated with lower levels of psychological health. And staff with disabilities experienced higher levels of negative behaviors, such as bullying, overall compared to staff without disabilities. And 14 studies reported on the impact that ableism had on their jobs and careers. So, for example, some participants mentioned how ableism often limited their career choices or altered their career pathways. And some also had missed clinical training opportunities because the training environments were inaccessible to them. For example, a study of nurses identified a link between experiencing or witnessing bullying and intentions to leave that job. And some people with non-apparent or less apparent disabilities were sometimes questioned about the legitimacy of their condition. So, to sum up, our review highlights the rates and types of disability of workplace ableism within healthcare professions, which occurred at both individual and institutional levels. And the impact of ableism on healthcare providers included difficulty disclosing due to fear of stigma and impact on health and career development. So some of the implications of these findings are that ableism is prevalent and could be discouraging people with disabilities from even entering healthcare professions and training. More efforts are needed to recruit, retain, support people with disabilities in the healthcare workforce. Healthcare providers who have a disability often experience workplace discrimination, inaccessible physical environments that can have quite profound impacts on their health and well-being and career development. Managers, senior leadership, and healthcare organizations should continue to advocate for improving the social inclusion of employees with disabilities. So some directions for future research. I think we really need to focus on documenting the rates and incidents of when, where, and how ableism is occurring, and considering also factors such as disability type, sociodemographic characteristics, employer type. Also, we can focus on assessing the impact that workplace ableism is having on job-specific outcomes, things like pay discrimination, career development, advancement, and so on. And we also need a better understanding of the factors that are affecting workplace ableism. And here, if you would like a full copy of our published article and review, feel free to reach out to one of our team members at trail, TRAIL, at hollandborough.ca, and we'd be happy to send you a copy. And thank you.